Colleagues, rare diseases, as we know, are in fact anything but rare. There are now more than 6,000 known rare diseases. 1 in 17 people in Ireland have a rare disease. That's 300,000 people. And when you include the mums and dads, the brothers and sisters, the sons and daughters who live with all of those people with a rare disease, it's likely that probably 1 million people in our country either have a rare disease or are living with someone who has a rare disease. And to all of those people, to the 1 in 17 with the rare disease, to their families, to their friends, to their carers, I say this: our ambition is to ensure that people with rare diseases have rapid access to the best possible healthcare. We're continuing to put in place screening measures and continuing to expand screening measures. We're investing in genetic testing. We're putting in place advanced diagnostics. We are continuing to invest in advanced treatments, including new medicines. And of course, I've listened very carefully to patients and to families who are saying that whilst, of course, the investment and the access to the new medicines is essential, much more than that is required. We must have suitable supports in people's homes and in their communities. I've met with patients many times in terms of rare diseases, including as recently as last week for Rare Disease Day. And I'm very aware that these conditions can often have a severe and quite devastating impact, first and foremost, obviously, on the person with the disease, but also on their families, also on their loved ones. And that is why this government has made a commitment to increase our focus on rare diseases, on those who are affected by rare diseases. And I will be making sure, as I'm sure all of us here in the Oireachtas will be making sure, that we do so. Through the development of a new national rare disease plan, this government is delivering for patients with a rare disease. This is why the task I set when I established the new rare disease policy unit in my department, which liaises with the rare disease office in the HSE and relevant stakeholders. In December, we established a rare disease steering group. This has met 4 times already to date, I'm very happy to report, and the group is tasked with developing our new rare disease plan. That sets out the vision for services, the vision for how we are going to support patients and families, and the actions required to achieve all of this. I am absolutely determined that this plan will be progressed, that it will look to the future, and that it will put the patient at the centre of everything we do. The voices of patients, the voices of families, the voices of advocacy groups must be central and have been put central in the development of future policy. That's why I have established a patient forum, so we have a formal mechanism for listening very carefully so that the patient voice determines the investment, the direction, the services that we put in place. And Ciarán, I'm very happy to say that the forum, which meets for a second time this week, is going to feed directly into the steering group and the strategy and the implementation plan. Screening, as we all know, is an important tool in terms of reducing the impact of rare diseases. I'm very happy to say that our National Screening Advisory Committee has already made 2 recommendations, one on SCID and one on SCMA, and I've written to them recently about the prospects for MLD as well, and I just want to note the advocacy by Les Martin and others on this. But we have more to do on screening. We are making progress, but we must set the ambition of being one of the leaders in Europe in screening, and we have a ways to go on that. Medicines, obviously, new medicines are essential in terms of provision of the best possible care for people with rare diseases. Over the lifetime of this government, we've allocated new development funding of nearly €100 million. The full year cost of that is far in excess of the 100 million. This year, colleagues will be aware, we've allocated €30 million. And I'm very happy to be able to share with colleagues that the money to date, not including the 30 million for this year, has led to the reimbursement decisions, the authorisation of 148 new medicines and new uses. And critically, colleagues, 39 of those medicines are orphan drugs specifically for rare diseases. Ciarán, in conclusion, can I say that this government will continue to work with those who have rare diseases. I want to acknowledge the strong voices of people like Deputy O'Sullivan, Deputy Naughton, Deputy Devlin, and others on this important task we have. Gurmageth.
Thank you, Deputy.
At the outset, thank the Minister for giving me some of his time, and also thank Deputy John Lahart, who can't be here today. He's also given me some of his time, so I appreciate that. Look, I'm going to start on a positive note for the Minister. He'll be glad to hear, and just to acknowledge the role that he has played over the last few years in terms of making progress on this issue. And a lot of it you've outlined yourself, Minister, in your opening statement, in relation to the expansion of screening. It's a major bonus for those families, and you've referenced Les Martin, who we both know well at this stage, and the great advocates that have been involved on that side of things. Also acknowledge that you are the Minister that has, kick-started the rare disease plan again, and we're going to get that hopefully in the next couple of months as well. And just appreciate the fact that you've started that process. I suppose also with the publication of MASARS, we're now going to obviously have this online tracker, which is also going to be a welcome tool for people in terms of improving transparency and so on for patients. Nonetheless, I'm just going to use the few minutes that I have just to highlight a few areas that still do cause me concern. And I suppose you mentioned there in your opening remarks about having rapid access to medicines. And consistently, and it's published in various medical journals across Europe, we're consistently at the tail end, in a European context when it comes to approval of drugs. And I hate just to focus all my time on drugs, but essentially, like, I'm looking at delays here of up to 1,100 days, depending on the drug, depending on the process that's gone through. But I suppose I've said this to you previously. At the start of this government's term in office, we were looking at 3-year periods for approval of drugs to go through the whole HTA process and so on. And unfortunately, we're still facing those kinds of delays in the process. And I do genuinely hope that MASARS, the publication of that, will improve stuff. But that's yet to be seen. So it's just to re-emphasise that. I saw recently, I think in Czechia, in the Czech Republic, they've actually published bespoke legislation that provides a specific orphan drugs pathway now, and that's something that we don't have here. And whether you can do something either legislatively or outside of legislation that would give us a separate process just to look at the rare drugs, and specifically, there's a lot of oncology drugs coming on the market, and how we get those to patients as rapidly as we can. The reason why I spend so much of my time talking about drugs is, I suppose, and I told you this story last week, Minister, I met a young girl here a couple of weeks ago who was coming in doing a presentation with Deborah Ireland, and I suppose I was talking to the mother. I just bumped into her, and I actually ended up taking a photo for them in front of the Dail, and I suppose they were coming in, I suppose, giving their life experience with the illness that poor girl suffers from. But also the reality, I was dealing with the pharmaceutical companies that was there with them that day. Like, they haven't lodged their application for HTA or anything yet. So that girl spends 4 hours every morning wrapping up in bandages. And unfortunately, with our process, she's going to spend the next 3 or 4 years of her life, unfortunately, going through that routine every day in agony because of our system, how laborious it is, just how slow it is. Now, I do acknowledge, Minister, what you have done. Like, for the first time in many years, we do have a number of drugs, and you mentioned them, the specific numbers there that have been approved. And until you came into office, genuinely, we didn't have any for a period of time. So I will acknowledge that, but it's just the frequency of those meetings where drugs are approved. I think that's something, again, that we should be looking at. It should be, I don't understand why we can't have monthly meetings of that drugs group that can approve drugs faster and get them pushed through that bit faster. It would be remiss of me not to mention, just in my last minute, the ERNs, the reference networks. And to be fair, you've met with a number of consultants, with myself and Deputy Lahart, particularly about staffing them appropriately, resourcing them appropriately, because going forward and to feed into the plans that you have, the rare disease plan, and with all the screening that I'm hoping will be expanded into the future, we're going to need the data that those guys have right across the continent. So I just give another, I suppose, shout out to resourcing those networks appropriately. So that's really it for me. So thanks, Chair.
Thank you very much, Deputy. Now we're on to the government slot, and we have Deputy Emer Higgins, Deputy Cormac Devlin, Colin Burke and Carl Crowe sharing 125 each.
Thanks very much, Laskin Corla. Wait times for access to medicine for those with rare diseases is growing, Minister. The Alliance of Rare Disease Companies Ireland tells us that Ireland now ranks 31st out of 37 countries when it comes to waiting lists for approval of drugs. Patients are waiting an average of 877 days for orphan medicinal products to be approved. That's over 2 years of uncertainty for them. 6 years ago, the joint Oireachtas Health Committee set about changing this. They called for a review of the evaluation and the reimbursement process for medicinal products intended for rare disease. Since then, we've seen the Mazars implementation report, which looked at this. But Minister, where's the follow-up? These patients need mechanisms that allow for direct and urgent access to therapies and medicines for their rare diseases. We're talking about people's lives that can be transformed if they've access to the right treatment. How can we deny them that through wait times?
Deputy Devlin.
And I welcome the opportunity to contribute on this debate on rare diseases. In the very limited time I have available to me, I'd like to welcome the commitment from Minister Donnelly to enhance the care and treatment for the more than 300,000 people living in Ireland with rare diseases. In particular, efforts to expand screening of newborns with the new heel prick test, which is particularly welcome. And I know that the new National Rare Disease Plan is being developed by the National Rare Disease Steering Group, which includes advocacy groups, medical practitioners, the HSE and indeed the Department of Health. And I look forward to examining the plan and engaging with stakeholders when the plan is complete. And finally, I'd like to join my colleagues and be associated with the remarks, particularly Deputy Porg O'Sullivan and Deputy John Lahart for all the work that they've done in this dual term in raising this particular issue, because they've been consistent advocates for it in this House. Deputy O'Sullivan just referenced Deborah Ireland, and I want to also acknowledge the work of Minister Rabbitte in relation to that organisation, because it's important that we look at those particular challenges, particularly for infants as well. So thank you for that, and we look forward to the report from the working group. Gurmagad.
Deputy Burke.
Thank you very much. I was in Farnley back in 10 years ago this year when the then Minister James Riley started dealing with this issue in rare diseases, and I suppose I'm disappointed that we've made very little progress in real terms. While some progress has been made, it's not enough, and it can refer to the report of 2018, which set out something like 15 or 16 recommendations about access to drugs for where rare diseases are concerned. That was the Joint Oireachtas Committee on Health. It was published on the 28th of February 2018. And I actually would ask that the Minister would go back and look at that report and the department to see how can we fast track the processing of drugs which are required for people with rare diseases. And I suppose the big challenge now that we have in relation to the pharmaceutical industry, because Ireland is a small country in real terms, the number of people with a particular rare disease is always small in number. Therefore, there isn't the attractiveness of a company to come in and go through the process here of something that has already been assessed by the European Medicines Agency. So I would ask that we would review how we are dealing with this issue. How can we fast track the process, and how can we make the drugs available in a timely manner? Because remember, the parents of these children have huge challenges in dealing with the complex conditions that their children have, and then to find that they can't get access to medication which is available in other jurisdictions. And therefore, I think this is something, the homework was done by the Health Committee already back in 2018. Let's look at that again and see how we can fast track the access and the availability for the medication that people require. Thank you.
Thank you, Deputy. Now we'll move on to Sinn Féin. We have Deputy Pauline Tully and Deputy Rose Conway-Walsh sharing.
So, Minister, welcome the preparation of a rare disease plan, but immediately this should have been commenced long before now. The current plan is 6 years out of date, as its time for its implementation was, at the time period, was over the 2014 to 2018. And we've over 1/3 of people with rare disease in Ireland have had to wait more than 5 years for a diagnosis. Currently in Ireland, only 9 conditions are included in the newborn newborn blood spot screening programme, while many other countries screen up to 20 conditions. I'm aware that approval for the inclusion of 2 more conditions, SMA and SCID, have been given, and this is welcome. But waiting for years for diagnosis can be deadly for many with severe forms of rare diseases, including SMA and SCID. These can both lead to death by the age of 2 without early diagnosis and treatment. So an expansion of the newborn blood spot screening programme should be commended. However, HICWA has stated that it is not anticipated that screening for SMA and SCID will commence prior to the opening of the National Children's Hospital, which is now not projected to open until at least Q2 of 2025, long after the Minister's implementation deadline of this year. There are an average of 6 babies born in Ireland every year with, for example, SMA. And these babies cannot afford further delays to the implementation of screening. So I'm just wondering, what steps is the Department of Health taking to ensure newborn babies are screened for these conditions in this year, in 2024, as committed to by the Minister, considering the fact that the new lab to be located in the new National Children's Hospital will not be ready until at least Q2 of 2025. And what consideration has been given by the Department for an interim solution to screen newborn babies for these conditions in order to bridge the gap between this year and the opening of the new hospital. Another rare disease I want to mention here is epidermolysis bullosa, or EB, which is a rare skin disease affecting around 300 people in Ireland. Those with the more severe form of EB endure excruciating pain daily, and is debilitating for all of those affected. And supports such as an EB-specific bandaging and dressing material scheme, mental health supports and home nursing care would make a huge difference to those with the condition, and indeed also the mental health supports for the families who are supporting them. I believe this condition is not included in the long-term illness scheme either, and I question why a lifelong condition with no cure isn't. And maybe this is something that could be taken under consideration by you, Minister. Thank you.
Thank you. Minister, I'm happy to have the opportunity today to speak again about the families that have been impacted by Valpride. This is where, as you know, Epilim continued to be prescribed to pregnant women, even though there was growing evidence that children of those mothers were being born with fatal Valpride spectrum disorder. This was a man-made rare disease. It was a preventable disease. Several international reports have noted the devastating birth effects relating to sodium valproate. In the Guide to Rare Diseases in Ireland, it states FVS is a range of devastating birth effects that can occur from the side effects of taking anti-epilepsy or other drugs, which contains valproic acid during pregnancy. Despite studies dating back to the 1980s, governments were slow to act in the overwhelming evidence of these side effects. Progress on addressing this issue is thanks to the advocacy of families led by one Irish parent, Karen Keeley. Thanks to Karen and to the patient advocacy group she founded, the Organisation of Anticonvulsant Syndrome, Oaks Ireland. There are now considerably heightened warnings about the dangers. The long-awaited promised inquiry has been far too slow. I understand that a chair for this inquiry is now sought. It's imperative that there is no further delays and that the inquiry is comprehensive with the families impacted front and centre. These families, some of whom have a number of children and adults with that condition, have suffered enough. These families deserve the truth as to know what people knew, when they knew it, and why, when there was mounting evidence, no one shouted stop. These families have been harmed. They have had to endure a rare disease that was totally preventable. And I do want to thank you, Minister, for at least agreeing to an inquiry. And I know that you understand how very, very important it is that that inquiry gets up and running as quickly as possible, and that we find a suitable chair that is going to get to the truth and the bottom of this matter and to be able to address the situation as it is. Thank you.
Thank you, Deputy. Next up is Labour Deputy Duncan Smith. 5 minutes.
Minister, last week I met with the Alliance of Rare Diseases Companies Ireland, which made one thing very clear. The current reimbursement system is not fit for purpose. We need to see a system that is clear, predictable and time-bound, with fixed assessment criteria and, most importantly, one that facilitates immediate or early access to rare disease therapies. As you mentioned in your own speech, it is a misnomer. Rare diseases are in fact not that rare, with 1 in 17 people in the country suffering with a rare disease. I welcome that you, Minister, are developing an updated plan in relation to rare diseases. But in the way of urgency, I think we need this plan as soon as possible. The implementation of the National Rare Disease Plan 2014 to 2018 was poor. There's no reason why a new plan cannot be expedited with a focus initially on the recommendations of the original plan, which went unactioned. However, while a new plan is important and long overdue, we can't have the situation again where we have a list of recommendations that go unactioned. And I would ask that you, Minister, commit to implementing as many measures as possible within the lifetime of this government and not to push the work of this group or indeed its actions into the next government. I'd also like to thank Labour local area rep for Skibbereen, Evie Nevin, who herself suffers from a rare disease, who took the time to share with me some of the difficulties that people like her, who suffers from Ehlers-Danlos syndrome, an inherited disorder that affects her connective tissue, to share with me the issues that she faces. One of the major issues for patients with EDS is a lack of multidisciplinary teams that can provide comprehensive and coordinated care. As a result, hundreds of families have resorted to fundraising treatment in the UK, Spain and the US, spending upwards of millions of euro collectively to access specialist care and treatment. For example, for Evie and her family have had to raise over €20,000 themselves to see doctors and physiotherapists in London. This is just not good enough. We have much too long a history in this country of exporting people with medical need to receive care abroad, and that should not be the case for any area, nor should it be the case of rare diseases. Another challenge that Evie outlines that patients with rare genetic diseases face, which is prominent across the health service, is the long waiting times. In this instance, for genetics appointments. This can have serious consequences for those with life-threatening conditions, such as vascular EDS, which affects the blood vessels and organs and can cause them to rupture. I would like to see the 29th of February, which was Rare Diseases Day, to be a springboard from which we really begin to address the flaws in our current system as regards rare diseases. The Minister's announcement on an updated National Rare Disease Plan is a positive step in the right direction, but I think he will acknowledge that there's more that we can be doing. Living with rare diseases can mean a lonely station with little contact with other sufferers and very little helpful information. I think there's an opportunity for the Minister and his department, alongside some firm changes, to run an awareness campaign. The public attitude is one of wanting to know more. We know this from a recent study that showed only 13% of people who claim to have an awareness of the term rare disease could correctly identify a condition. Importantly, though, 69% expressed an interest in learning more about rare diseases. The Minister and his department should build on this, particularly when statistics from this survey that show 82% of all respondents agree that these conditions need to be taken more seriously. I would also like to raise the point with the Minister that the Alliance of Rare Diseases have called for the appointment of a designated liaison person within your department with which to discuss rare disease policy. Now, I know you mentioned liaising in your own speech, but I'd like you to give this further strong consideration, that there be one point of contact at a senior level. And it would be remiss me not to acknowledge your own commitment to this issue, Minister, which I say so sincerely, and indeed the works of Deputy O'Sullivan and Deputy Naughton in this House over the 4 years I've been here is something I'd like to acknowledge as well. Thank you.
Thank you, Deputy. Next up is Social Democrats, Deputy Roisin Shortall.
Last week, along with other members of the House and Deputy Naughton, I had the pleasure of attending the I Am Number 17 exhibition launch in St. Stephen's Green. The exhibition features 17 people living with rare diseases, reflecting the fact that 1 in 17 people will be affected by a rare disease at some point in their lives. Putting their stories on display in the heart of our capital city, just a stone's throw from the Oireachtas and government buildings, is certainly a powerful statement, and I would encourage members to visit that exhibition. Recently, rare diseases policy reform has been put back on the political agenda, thanks to the advocacy of patients and their families. I also acknowledge the commitment of the Minister to addressing this issue. 6 years after the last rare disease plan expired, a new plan is finally being developed, and that is very welcome. However, implementation of that plan is the key thing. After all, many of the recommendations from the last national plan remain unimplemented. That cannot be repeated this time round. One of the key actions must be reducing the length of time it takes to receive a diagnosis. As of May 2023, the waiting time for a clinical genetics outpatient appointment was up to 2 years. However, getting a final diagnosis for a rare disease is often even longer and a more convoluted process. A 2022 Rare Diseases Ireland survey found that 21% of patients waited 2 to 5 years for a final diagnosis, while 14% waited between 5 and 10 years. Incredibly, for 23% of patients, the wait was a staggering 10 years or more. One of the key findings from the research was that a lack of rare disease awareness, particularly among GPs and emergency doctors, led to delayed diagnoses and treatments. A recent 10% increase in genetic service referrals between 2020 and 2022 would suggest that the tide is beginning to turn. However, we still have some way to go before bridging the knowledge gap in primary care, emergency care and social care. If the new plan is to deliver for patients, increased capacity in genetic and genomic services is also required. According to a 2023 Rare Diseases Ireland report, the Republic of Ireland has 4.3 genomic staff per million population, well below Northern Ireland's 8.4 staff per million population, while the wait time for a first clinical appointment in this jurisdiction is a staggering 24 months, 8 times longer than the North's 3 months. I acknowledge that some progress has been made following the publication of the National Strategy for Genomics and Genetic Medicine, but it is regrettable that the 2023 recruitment targets weren't met, and now a recruitment freeze is in place. So it's very hard to know where we stand in terms of implementing that commitment. People with rare diseases also experience very fragmented care with limited and disjointed access to services. 73% of respondents to Rare Diseases Ireland's survey in 2022 said that their care was not coordinated effectively, while only 15% had a personalised care plan in place. This lack of coordination should improve with the implementation of the regional health areas, but a strategy for rare disease management at national level will still be needed to address quite specific shortcomings in service integration. Undoubtedly, there are many other relevant issues, such as investment in rare disease research, implementation of e-health, and access to orphan medicines, but my time is limited. So in conclusion then, I would just like to state that the Social Democrats' support for the development of a new rare disease plan, an updated roadmap for the prevention, diagnosis and treatment of rare diseases is long overdue, and I look forward to its publication. We hope sooner rather than later, but later this year at some point. Thank you.
Thank you, Deputy. Next group up is the regional group, Deputy Dennis Malcolm.
Thanks, Cahirley. And at the outset, can I echo the comments by colleagues in relation to access to drugs, expansion of the heel prick test and the implementation plan for rare diseases. One thing, having a plan, having it implemented is something different, and I want to echo those. But I think the surprising thing about rare diseases is, despite their name, they're collectively quite common, affecting at least 1 in 17 people in Ireland, equating to approximately 300,000 people, the length and breadth of this country. And this figure is likely to be an underestimation, with the true prevalence of rare conditions probably higher. And in a country like ours, a small country, it's likely that each and every one of us have encountered someone affected by a rare disease. And as colleagues have said, the path to an accurate diagnosis is fraught with challenges. The lack of specific knowledge and expertise often leads to significant delays in receiving proper treatment, placing a heavy burden on families and carers. And the anguish of being ill without diagnosis or witnessing a child suffering without recognition is profound. Thus, securing an accurate and swift diagnosis is of critical importance. And turning to the point that Deputy Shortall made in relation to genome sequencing and access to it is vitally important. Now, last week, a number of us attended a family where there was a conference, an all-island conference on rare diseases. And one of the discussions referred to a review article that has just been published in Genomic Medicine. And it's reviewing the use of first-line genome sequencing to diagnose rare diseases disorders. It's research that's been conducted in the US. It's a review article of research around the globe. And interesting in that particular academic paper is that it points out that the disparities in healthcare access and outcomes that are a persistent issue, that genome sequencing can help overcome this and provide a unique opportunity to bridge the gaps by providing equitable access to advanced genetic diagnosis. Implementing policies that promote genome sequencing accessibility can mitigate these disparities, ensure all patients, regardless of socioeconomic status or geographic location, will have access to state-of-the-art genetic testing. This approach not only enhances patient care, but also promotes fairness and equity within our healthcare services. The report goes on to highlight the initial costs of genome sequencing are balanced by its comprehensive diagnostic capability, potentially reducing the need for multiple and sequential genetic testing. And by adopting genome sequencing as a first-line test, we can optimize resource allocation, reduce long-term health costs through more efficient diagnosis and management of genetic disorders. And we need to consider the long-term benefits of this, not just looking at it in relation to acute or exceptional cases, but that it is available far more broadly in our healthcare system in this country. And that review article makes the economic as well as the healthcare case in relation to that. And I think that is of importance and cannot be ignored in relation to this. Minister, 37% of patients in this country endure a grueling 5-year quest to get a diagnosis. And Irish research reveals that children with rare diseases occupy hospital beds 25 times more than their peers. And yet, our efforts to harness the potential through a national genomic strategy for genetics and genomic medicine has been hampered by the recruitment process, by the embargo in relation to the recruitment of staff, and the absence of a designated home for a new central genetics and genomic laboratory. There isn't provision being made for it in the new Children's Hospital as of now. And I'm asking you, Minister, to develop the site that's going to be decanted in Crumlin as the centre of excellence in this country for genomics medicines, and put the resources in there and provide the accessibility, not just for people with rare conditions, but more broadly as part of a diagnostic healthcare tool, because it will save our health service, it will provide rapid diagnosis and ensure that far more people get timely care that they need. Thank you.
Thank you, Deputy. And next on the list is non-aligned Violet Anwin.
I
want to begin by acknowledging the various constituents who took the time to reach out to me, to inform me, to relay their personal stories, and in some cases reliving the inevitable trauma that they experienced. They encouraged me to support the campaign to get Rare aware, and also Rare Diseases Ireland, and I'd like to thank them for their continued and passionate advocacy. I also want to remember the 12% of children living with rare diseases who pass away before they turn 18, and all of the family and people who are affected by rare diseases. Minister, I want to talk about the Rare Reality Survey for a minute. The survey responses indicated that the journey to diagnosis is far too long, oftentimes too fragmented and far too stressful. 37% of respondents waited over 5 years for a diagnosis. 53% were assessed and in some cases treated for 3 different conditions on the journey to diagnosis. 72% saw 3 or more consultants in different specialities on their journey to diagnosis. 77% of those accessed genetic testing received a definitive diagnosis. And Minister, highlighting the significance of the issue, 3/4 of respondents received genetic testing results within 3 months when they went private, and the same figure is just 38% in the public system. Another report, Minister, Ending the Wait, made 4 main recommendations, and I want to support them in the House here this afternoon. Firstly, Minister, we must accelerate recruitment and expand the types of roles within genetic services. This will allow senior clinical staff to focus on the complex tasks such as diagnosis and create an important resource pipeline. Secondly, we must equip clinical teams with the resources to achieve further efficiencies in pathway management. Thirdly, we must empower clinical teams to implement interim technology solutions. And finally, Minister, we must utilise accessible capacity and build cross-border services here on the island of Ireland through collaboration with services in the north. Gurmagat.
Now back to the government. Yeah, everybody else has spoken. Thank you, Minister.
For the closing statement, is it, Chairperson?
Yeah.
Thank you.
5 minutes.
I'd like to thank all the deputies who participated in this debate and for your interest and contributions on this really important topic. So we know that many rare conditions are both severe and complex, and that patients can face multiple challenges, including difficulties accessing appropriate medications. The development of a successor to the previous National Rare Disease Plan is a key priority for the Department of Health in order to enhance care and treatment for the estimated 300,000 people in Ireland living with a rare disease. The Rare Disease Steering Group has been tasked with developing a new national rare disease plan for Ireland and sets out the vision for rare disease services in Ireland and the actions we have to undertake in order to make this vision a reality. The development of this strategy will be informed by contributions from the New Patient Forum, which puts the voices of patients and families at the centre of policy making. It's vital that the views and lived experiences of those affected by rare diseases are central to the work that we do. As previously stated, the development of a new strategy will allow us to consider areas of the previous plan that need to be further progressed, while also looking to the future and responding to the needs of patients. It was evident that there has been an increased focus on rare diseases in the last number of years, which is very welcomed. The events that took place across the country during Rare Disease Day last week highlight the tireless work of patients, advocacy groups and the public, increasing our awareness of rare diseases. It also highlighted that while rare individually, collectively, rare diseases are much more common than many of us may think, affecting an estimated 6% of our population. The development of the new National Rare Disease Plan, due to be published later this year, marks a renewed focus on rare diseases and fulfills the commitment made within the programme for government. It's hoped that this new strategy and its implementation will address gaps in rare disease services and ensure that patients and their families receive the right care at the right time in the right place. And finally, I'd like to once again thank all the deputies who participated in this debate today, and to assure you that the government is fully committed to doing everything possible to reduce the impact of rare diseases and improve services and treatments for people living with a rare disease diagnosis in Ireland. Thank you.
Thank you very much, Minister. And that concludes the statements on rare diseases. Thank you.